According to Dr. Oz, who spent years in the operating room as a renowned heart surgeon and even more years sharing health advice on TV, nearly 47% of Americans have at least one major risk factor for heart disease, whether it's high blood pressure, high cholesterol, or smoking. Dr. Oz has seen firsthand the toll heart disease can take, and he's on a mission to help people recognize the warning signs before it's too late. But here's the twist. Most folks don't even realize they're at risk. So in this video, we're diving into 8 signs that your heart might be in danger and you might not even know it. Spoiler alert, poor lifestyle choices are often the biggest culprits. Let's kick things off with a shocker. 1. Jaw pain. Yep, you read that right, jaw pain. I know it sounds strange, but if you're feeling intense discomfort in your jaw, it could be your heart sending out an SOS. When your heart isn't getting enough oxygen, the pain can radiate to your jaw, neck, or even your back. This is known as referred pain, where discomfort from one part of the body is felt in another. It can be particularly confusing because jaw pain is commonly associated with dental issues or temporomandibular joint disorders, or TMJ. However, if you're experiencing unexplained or persistent jaw pain, especially if it's accompanied by other symptoms like shortness of breath or chest discomfort, it's crucial to seek medical attention immediately. Item number 2, swollen legs or ankles. You might think swollen legs or ankles are just a sign that you've been on your feet too long, but they could be waving a red flag for heart failure. When your heart isn't pumping blood as efficiently as it should, fluid can build up in your tissues, particularly in your lower extremities, leading to that puffiness. This condition, known as peripheral edema, occurs because the blood flow back to the heart is slowed, causing fluid to accumulate in the legs, ankles, and feet. It's important to note that while swelling can also be caused by other factors like sitting for extended periods, pregnancy, or varicose veins, persistent or severe swelling can indicate a heart issue that requires medical evaluation. Prevention tip. To help prevent fluid retention and swelling, try to stay active throughout the day. Regular physical activity can improve circulation and help prevent fluid buildup. If you have a sedentary job, make it a habit to stand up, stretch, and walk around every hour. Reducing your salt intake can also prevent fluid retention. Additionally, elevating your legs while sitting or sleeping can help improve blood flow back to the heart. If you notice persistent swelling, consult a healthcare professional to rule out any serious conditions. Item 3, shortness of breath. Ever find yourself huffing and puffing after climbing a few stairs, even though you're not out of shape? It could be a sign that your heart isn't pumping blood effectively, making it harder for your lungs to get the oxygen they need. This symptom, known as dyspnea, can occur when your heart is too weak to pump blood efficiently, leading to a buildup of fluid in your lungs. This can make breathing difficult, especially during physical activity or when lying down. While shortness of breath can also be caused by conditions like asthma, allergies, or being out of practice with exercise, if it's happening regularly and without a cause, it's time to have a heart-to-heart with your doctor. Prevention tip. To prevent shortness of breath related to heart issues, focus on maintaining a healthy weight. Excess weight can put extra strain on your heart and lungs, making it harder to breathe. Incorporating regular cardiovascular exercise into your routine can strengthen your heart and lungs, improving your overall endurance. Managing stress through relaxation techniques like deep breathing, yoga, or meditation can also benefit your heart health. And remember to stay hydrated, as dehydration can make your heart work harder, exacerbating shortness of breath. Item 4, cold sweats. Breaking out in a cold sweat for no apparent reason can be scary, and it should be. Cold sweats are often a sign that your heart is in distress, possibly due to a blocked artery or an impending heart attack. When your heart is struggling to pump blood through narrowed or blocked arteries, it can trigger your body's fight or flight response, leading to sweating, even if you're at rest. Cold sweats are particularly concerning when accompanied by chest pain, nausea, or dizziness. So if you're not doing anything physically demanding and suddenly find yourself drenched, it's worth paying attention to. Prevention tip. Preventing cold sweats related to heart problems involves taking steps to reduce your risk of heart disease. Regular checkups with your healthcare provider can help monitor your blood pressure, cholesterol levels, and overall health. Eating a heart-healthy diet rich in omega-3 fatty acids found in fish, flaxseed, and walnuts can help reduce inflammation and prevent artery blockage. Managing stress is also crucial. Chronic stress can contribute to heart disease and trigger symptoms like cold sweats. Consider practices like mindfulness, deep breathing exercises, and regular physical activity to keep stress in check. Item number 5, nausea or indigestion. We've all had that "I shouldn't have eaten" that moment, but persistent nausea or indigestion could be more than just a bad meal. It could be your heart's way of telling you it's struggling. When your heart is not functioning properly, it can affect the digestive system, leading to symptoms like nausea, indigestion, or stomach pain. This is particularly common in women who may experience these symptoms during a heart attack, instead of the more typical chest pain. If your stomach's been acting up for no good reason and is accompanied by other heart-related symptoms, it might be time to consider your heart health. Prevention tip. To help prevent heart-related digestive issues, pay attention to your diet. Avoid heavy, fatty, or greasy meals that can be hard to digest and put extra strain on your heart. Eating smaller, more frequent meals can also help prevent indigestion. Staying active can aid digestion and improve heart health, so try to incorporate regular exercise into your routine. Limiting caffeine and alcohol, both of which can exacerbate indigestion and put stress on your heart, is also wise. If you're experiencing persistent digestive symptoms, consult your doctor to rule out any serious heart conditions. Item number 6, dizziness or lightheadedness. Feeling like the room is spinning or you might pass out, it could be your heart signaling that it's not getting enough blood to your brain. This can happen if your heart isn't pumping blood as effectively as it should, leading to a temporary drop in blood pressure. Dizziness can also be a side effect of certain medications, dehydration, or even anxiety. However, if dizziness or lightheadedness occurs frequently or suddenly, it could indicate a more serious heart issue, like arrhythmia or heart attack. Prevention tip. To reduce the risk of heart-related dizziness, make sure you're staying hydrated. Dehydration can lead to low blood pressure and dizziness. If you're on medications that may cause dizziness, talk to your doctor about adjusting the dosage or trying alternatives. Incorporating balanced exercises like yoga or tai chi into your fitness routine can also help prevent dizziness. Avoid sudden movements such as standing up quickly from a seated position, as this can cause a drop in blood pressure and make you feel lightheaded. Item number 7, persistent cough. A nagging cough that won't quit could be a sign that your heart is having trouble. When your heart isn't working efficiently, it can cause fluid to build up in your lungs, leading to a chronic cough or wheezing. This condition, known as congestive heart failure, can also cause shortness of breath and fatigue. While a cough can be caused by a variety of factors like allergies, asthma, or respiratory infections, persistent cough that produces frothy or pink-tinged mucus is a red flag that warrants a visit to your doctor. Prevention tip. To help prevent heart-related coughing, focus on lifestyle changes that improve your heart health. Reducing your intake of salt can help prevent fluid retention, which in turn can reduce the risk of fluid buildup in your lungs. Regular cardiovascular exercise can strengthen your heart and lungs, improving overall respiratory function. Avoid smoking and exposure to secondhand smoke, as it can worsen heart and lung conditions. If you have a persistent cough, especially if it's accompanied by other symptoms like shortness of breath or fatigue, seek medical advice promptly. Item 8, fatigue. We all get tired, but if you're feeling exhausted all the time, even when getting enough sleep, your heart might be to blame. When your heart isn't pumping blood as well as it should be, your body isn't getting the oxygen it needs to function properly, leaving you feeling like you've been hit by a truck. This type of fatigue is often described as feeling unusually weak, sluggish, or drained, even after a rest. It's one of the most common symptoms of heart disease and should not be ignored, especially if it's accompanied by other warning signs like shortness of breath or chest pain. Prevention tip. To combat heart-related fatigue, ensure you're getting regular exercise tailored to your fitness level. Even moderate activity like walking or swimming can boost your energy levels and improve heart function. Eating a balanced diet that includes plenty of fruits, vegetables, and whole grains can help maintain your energy levels and support heart health. Make sure you're getting enough sleep. Aim for 7 to 8 hours per night, as chronic sleep deprivation can exacerbate heart symptoms. If you're experiencing persistent fatigue, it's important to consult with a healthcare professional to determine the underlying cause. Before we wrap up, let's talk about how to keep your heart happy and healthy. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains is a great start. And don't forget to keep moving. Regular exercise can do wonders for your heart. Lastly, keep an eye on your stress levels and make sure you're getting enough sleep. Your heart is literally the engine that keeps you going, so it's crucial to pay attention to what it's telling you. Don't ignore the signs and take action if something feels off. And don't forget to like, subscribe, and share this video to help spread the word about heart health. Here's to a healthier, more informed you.